Welcome to the Power of Lifting podcast. I'm EricCafferty, owner of the Mecca Gym. I am a strength and conditioning coach and a contest prep specialist. The focus of this podcast is to dive into the mindset and the drive of people who have done incredible things with their lives.
We'll get there.
I'll let you know, but we're 34 or 35.
Yeah, so we're getting up there in episodes, and I want to welcome back an extra special guest.
That's right.
A doctor, no less.
Yeah.
The muscle doctor.
The muscle doc.
Dr. Kaleb Redden. Welcome, sir.
It's a privilege and honor to be here with you gents.
You know, I feel like every time I share the room with Kaleb, my testosterone levels just go up.
Oh,
and
yeah, I'm
I
vibing at this point.
instantly get to be more of a man.
That's right.
Well, that's quite an honor and a compliment coming from a guy with a beard like that.
It's just, it just is, it radiates off of him. Just the manliness and the good man he is. So
the earned confidence.
I loved our first episode.
Yeah, it was a lot of fun.
I think that people have a lot to learn from you, and so we had to have you on again. Number one, because of your pretty face and great haircut.
Got a mullet.
You gotta show that off.
But we've had a lot of requests for talk about, injuries and, what happens or what you should do in, when you get injured in the gym or, say in a powerlifting meet. I've actually had a lot of people reach out about just injuries and how to manage them.
Yeah.
35.
35. That's the official.
35. We're officially there. And Mr. Dr. Redden here was number 3.
Number
to go back
3.
if you want to listen to that
There
one,
you
which
go.
we highly recommend.
Yeah, go listen to that one either before or after you listen to this. The man's full of knowledge, and we're going to tap into
Incredible
that
stories.
again. But yeah, so injuries, and I feel like the Mecca. I have kind of inherited in some way, shape, or form a lot of individuals that are post-op, post-surgery, or going through a lot, or have gone through some issues with injuries and things like that related to, say, improper technique or just competing at a high level. And just because of my background, it's that's something that I definitely specialize in, is how to get people back on course after injuries and things like that. But I by no means am an athletic trainer, although I do know a lot. I don't know enough, nor do I proclaim to be at that level. And as far as having the authority on sports injuries and things like that, there's nobody better to hear that from than you, because you know it all.
No.
Been there, done that. Well, I think what's impressive too is when I hear of somebody who's like, "Oh, I was injured." Every single time I talked with Dr. Redden and EricCafferty, and they put me on a plan, and now I feel better. When it comes to a member here, or somebody I've interacted with here, it's always both of your names, and I am doing better now.
That's good.
Yeah,
That's an equation, right there.
It takes a multidisciplinary approach, I think, if you really want to achieve that level of of greatness. A lot of times when people have a mechanical injury, when they're injured, they go to a healthcare provider, whether that be a nurse practitioner, PA, physician, chiropractor, physical therapist, whatever it may be. A lot of times, if that person providing the care doesn't have a working knowledge of their sport, whether that be croquet or powerlifting or handball or baseball, football, whatever the stick and ball sport, running, hockey, whatever it is, if that provider doesn't have a working understanding of that sport, then often the go-to or sort of the umbrella treatment plan revolves around avoidance of the insult. Let's avoid the insult, right? Avoid the insult. Let's engineer out the hazard. If what you were doing created injury, created pain, then if we stop doing that, then things should improve.
Yeah, just stop lifting.
Just stop lifting.
That's like telling one of our clients to stop breathing.
Yeah, that doesn't work very well.
Forget about it.
And I think that's what's really unique and special about seeing a sports medicine physician, not just myself. Granted, I may have some working knowledge of lifting weights, maybe more so than most of my colleagues, but
I would concur with that.
But
seems to check. Yes,
I definitely don't know it all, but I do have a working understanding of lifting weights and fitness. But the truth is, most sports medicine physicians are going to tell you they want you to get back to doing what you're doing faster. That's the difference between medicine and sports medicine. And so I think that it works so well, such a symbiotic relationship between the personal trainers and the coaches with the physician. And then I also incorporate physical therapists, and my team are athletic trainers. So that's a multidisciplinary team that then the client, the person who's been injured, has full access to, which truthfully, that's the best treatment plan, includes those people, because they have the highest level of education, the most experience and understanding, and they create a tailored approach to rehab and to overcoming the injury, overcoming and adapting to potentially the mechanical changes that need to occur. So really, it does work really well. And I think that part of that, like, you're mentioning that, like, it's really cool for me to be a member of the gym and to be on the gym floor at any given time. I can walk out on the gym floor at 4 a.m. or at 4 p.m. at night. It doesn't matter. And there'll be a patient of mine in the gym.
Absolutely.
And that person, awesome. And it's really cool to see those people that I'm seeing in the clinic, to see them here, to see them doing what they want to do. Before we came in here to do this podcast, I had a patient come up and was like, "Hey doc, I've been this has been bugging me. Can I come see you?" And I'm like, "Absolutely. What do you think I should do today? I'm training back." And I'm like, "Let's modify a few things here. Don't stop training back. Like, don't stop. Like, don't quit. Modify a little bit, continue." And I think that that's always been my approach with medicine in general, and with injury, is like, let's modify, let's adapt, let's overcome the obstacle, the adversity, and let's continue doing what you want to do, and do so within reason. Now, granted, and I can go on and on and on talking about that, but I think that it's something that's unique when people come into my clinic and they're like, "Wait, you're telling me that you don't want me to quit deadlifting?" Nope, I don't. I want you to stop conventional deadlifting and switch to a sumo deadlift, but I don't want you to quit deadlifting. Wow, and then last time I talked to a doctor, they told me just to stop deadlifting, right? So like, and that's okay. Like, the truth is, there's nothing wrong with telling someone to stop doing what's hurting you. Like, that's not bad advice, right? Don't get me wrong, it's not bad advice, but that's not always the best advice.
Yeah,
right.
it's
that's
just
good, better, best
there's
situation.
There's just levels in in every profession, right? With trainers, right? There's not going to be every trainer that can, talk to Kaleb about some of these complex issues and and understand what, random syndromes and things like that are, right? So, it takes some knowledge base, but, there's just different experts in different areas, right? So, like Kaleb was mentioning, before Kaleb was practicing, I would never have sent somebody to a doctor, because I would have been, probably horrified at the advice that the person got, because, the doctor was, meant well and was, trying to get the patient healed, but they just they would give good advice maybe to get the person healed, but not to, like Kaleb said, maybe be able to work around these issues. And you hurt your back, you got to stop doing everything. And it's like, that's the worst thing that you could possibly do, is stop doing everything. So I think while a lot of doctors understand how to heal injuries, obviously that's kind of a no-brainer, that's what they went to school for, they don't have the working knowledge of muscle activation in different exercises, right? And the same goes for PTs too. Like, not all PTs know that, although the information is there to learn in medical school, the information is there to learn in PT school, the information is there to learn in an exercise physiology program. A lot of it boils down to what that person has focused on, and where their passions lie as well, because they're gonna know, like, there's a huge difference between Kaleb's knowledge base on functioning muscle groups and or joint reaction forces, you name it, when it comes to lifting weights, powerlifting, deadlifting, squatting, specifically in bodybuilding type movements, right? compared to another sports med doc off the street. Another sports med doc might be an expert in swimming.
Yeah.
Because they coached or play or swam at the Olympic level, and now they're a sports med doc. And well, this guy's banged iron for years and years, right?
Yeah.
So he is a subject matter expert in specifically sports medicine for lifting, and I can't tell you how great it is that he's around and that we get to talk to him on this podcast, because there is expertise within expertise, right?
Like the levels you talked about.
Exactly. So it's not that I'm saying that no other doctors are good. I'm just saying that he has an understanding that goes beyond what a doctor would be expected to understand to practice medicine.
Yeah.
A lot of sports med guys are dealing with, this person separated their shoulder skiing, or broke a bone doing XYZ, but they're not necessarily like, okay, well, somebody just threw their back out deadlifting and this is a problem. What do we do? So to segue into that, I think a lot of listeners, everybody at one point in time, they've had a back issue and they've had a shoulder issue.
Yeah.
Without a doubt. And I hate to say that, but I think we are all members of that club as well, because things just happen, and when you play hard, things happen. So let's just start off here by kind of walking somebody through the right channels. So somebody's in the gym lifting weights, and something happens. They're deadlifting, they feel pain in their lumbar. What are some of the different things that are common things that happen there, and where does somebody go from there?
Yeah, the majority of the time, and I would say, I agree with a lot of the things you mentioned there, and I think that a lot of it really comes down to the mechanism of injury and making sure that you have the appropriate diagnosis to start.
Gotcha.
So as long as you've got the right diagnosis, then the treatment plan can follow. And I think that a lot of times in this, right, wrong, or indifferent, I think a lot of times the cart and the horse get mixed up a little bit. People have a treatment plan, but they don't have the right diagnosis.
Right.
And maybe that treatment plan is a great plan, but not for the diagnosis.
Right.
For what they have, right? So with the information age that we have, everybody's got access to WebMD, Dr.
WebMD.
Google.
Dr. Google.
Dr. Google. I don't know where he went to medical school. But
probably Google University.
Yeah, Google University. Right. But the thing is like everybody has an opportunity to look up their symptoms right away. And the truth is, a lot of times injuries mirror symptoms. So like you can have multiple symptoms for a shoulder prime example. Like you can be pan positive and think that you've got a myxoid lipoma or a sarcoidoma or something like that, and it turns out you don't. You just have bursitis. So, but the symptoms are the same. But so I think a lot of it comes down to making sure that you start with the appropriate diagnosis. So making sure that you understand what's going on first, and a lot of it comes down to when you come in to see the physician or the the doc in the sports medicine clinic. And I'd appreciate what you've mentioned, and I think that my partner Trek, Dr. Lyons, which we ought to get him on here too.
Oh boy.
Trek's also somebody who he's been one of my mentors, and I sit next to him now, and he's another doctor
Trek's
that does
great.
a phenomenal job of understanding the fitness industry and lifters in general. And so I bounce a lot of ideas off of him at work too. But I think if you start with the right diagnosis, so when you get injured in the gym, if you take a step back, like there's going to be some red flags and some white flags, like where you need to stop. You got to have the white flag. There's going to be some red flags where there's some danger zone, there's some real problems that can occur. But then there's a lot of the stuff that's in the middle, and I think that it's always reasonable to just step back first and kind of just reassess, listen to your body. So it's really common for people to tweak their back in the gym, and they create a mechanical disadvantage that causes pain. That can happen on a warm-up. That can happen on a max, and I've seen everything in between.
The thing that I think needs pointed out and also explained here is a lot of people say, I threw my back out.
Yeah.
I'm like,
that's a common term.
Quit saying you threw your back out.
Or I've got sciatica.
Or I've got sciatica. It's like, well, you didn't throw your back out.
No, you're right. That's a really interesting, that we should probably just start with that, because that's probably one of the most common things that you see in the gym, and it can happen literally doing shoulders.
Oh yeah.
Or squatting and deadlifting. Like, it really can happen anyway in different ways. And so really what happens is most of the time, and I wouldn't say all the time, and again, this information is meant to be informational, not for diagnostic.
Right.
This is educational and just to give people an idea. So of course the number one recommendation is to be evaluated. Get looked at by your, come and see me. If you're listening to this podcast and you're part of the gym, you have an open invitation to the clinic. So you go and see the physician first, you get the workup, and the workup usually includes x-rays because you got to understand what the mechanics look like. So you get an x-ray, you do a physical exam, you listen to the history, you get the mechanism of injury figured out, you come up with a diagnosis, and then you get a treatment plan. So that needs to happen. But regardless, when you throw out your back, if we're going to talk about that in general, most of the time what actually occurs, the way the spine is developed, you have the vertebral bodies, which then articulate with each other through the facet joints, right? Yep. And in between the vertebral bodies are intervertebral discs. Those discs are made up of a very hard cartilaginous structure called the nucleus pulposus, and on the inside the annulus fibrosus, and on the inside is the nucleus pulposus. Like, that's a cushion in between the vertebral bodies. Now, all of that structure is held up with muscles, and there are a lot of them. There's a ton of them. So there are muscles that go in between the spinous process, in between the transverse processes, the multifidi, the rotatories, and these are all muscles that people don't know about.
So yeah, and that's the interesting thing too that people have to understand. When you have pain in your back, and it's literally could be one of a million things.
Right. So it's exactly, yeah. It's not just a one shoe fits all. When I threw my back out, it could be in a multitude of different things.
Do you think people use that as maybe a cop? I don't know. Maybe it's people don't understand, but it's a catch-all.
I all of a sudden have back pain.
So I threw my back out.
I threw my back out.
Maybe it's almost like a
So what
deal.
They can come in, and what can actually have happened is they may have had a shift in their vertebral body. So those vertebral bodies changed orientation a little bit. And then one of those small muscles like the multifidi or the rotatories or the semispinalis will tighten up to try to keep that movement from occurring.
Sure.
And then you initiate a cascade of cytokine response, which is a cellular signal that then relays information to the muscles that are then proximal, which are the more of the longissimus, the erector spinae group. Beyond that are the latissimus dorsi and the quadratus lumborum. And so they basically send a chain reaction that then is a ripple effect, almost like a wave in a pond, and it creates contractile forces that then seize everything up. And so
then everything's tight.
Everything's tight.
Right. So
everything
then at that
hurts.
point, like, I threw my back out.
Yeah.
Well,
everybody.
Now your
hurts.
your entire lumbar is just super stiff, and
your glutes hurt. It hurts to sneeze, cough, laugh.
Yeah.
But the truth is along that cascade, you could have got an annular tear in the disc. You could have got a rupture of a disc. You could have got a facet joint. There's cartilage in between the facet joints. You could have nicked a chunk of that cartilage off. You could have pinched one of those muscles. You could have, there could be a million different things.
Okay.
But if you want to lump,
complex.
If you lump it under, like, I threw my back out, like the umbrella term, I threw my back out, I would say 89 to 92%. You'd have to double check me on that one, but I would say about 89 to 92% of the time that is related to mechanical lower back pain, not related to sciatica, not related to a herniated disc, not related to a fracture, not related to all the red flag things. And most of the time with conservative treatment, with the appropriate treatment plan, most of the time those will get better without any long-term deleterious outcomes. But you need to make modifications. And here's the important part is, like, no matter what the diagnosis is, whether it's an annular tear or a muscle that has been damaged, sprained, strained, whatever you want to call it, if you continue to lift and you're hurt, then you start to change movement patterns, and you start to create new neural pathways that then lock in those movement patterns. So the truth is, I tell people a lot of times, like, if you feel something tweak, if you threw your back out in the gym, don't keep doing what you're doing. Like, if you're squatting, stop. Like, go get on the leg extensions or go train biceps. Like, don't leave the gym. Finish your workout, but make some modifications so that you don't pile the nail right through the end of the coffin and just seal the lid down. Like, just let it ease up. Try not to move it, try not to make it worse by continuing to do what you're doing. Because I've seen a lot of times people come in like, I felt it tweak on like the third rep, and then I added more weight and I thought I'd keep going. Like, that probably wasn't the best idea. Now, was it the worst thing in the world? No, you're not going to die, but at the same time, maybe this could have been prevented with some commonsensical changes. But
I feel like men need to hear that more.
That's probably something I see with guys more often. But
I mean,
I'm good. I'm good.
It hurts, so I put more weight on.
I got it, bro. I need 2 more cookies on there. Let's get this thing down.
Yeah, exactly. No, it's funny. You talk about the whole, throwing your back out term, and I feel like I've literally thrown my back out, like in the literal sense. I think that translates to a spondy. You know what I mean?
Right. Yeah.
Totally. Spondylolysis. I remember calling Caleb going, my back's real pissed.
Can you come
Real
pick me up off the
pissed,
floor,
yeah.
please?
And it's funny. It was the day after I had done a powerlifting meet. And I was squatting the day after a meet because, naturally I had regionals coming up. And I was, what was I doing? I was like 525 for fives or something like that. And
it's a hefty load.
Rep 4, I went down and I just didn't brace well,
Sure.
and came up or, kind of hit the hole and just felt my entire spine shift.
Yikes.
Oh no. And I knew fairly immediately what I had done because I literally felt it happen. And I have a pars defect in L5, so it's like, that's already a kind of more at-risk situation.
Yeah.
So but yeah, that's like I said, we've all been there.
That's another thing too, like that you could literally, it's rare that you would do it in the gym, but unless you're doing like a military press or a log press, you could fracture your spine, and that's a pars defect.
Right.
Pars intra-articularis fracture, and that can lead to a spondylolysis, which is what you're talking about, and that is shifting of the bones that shouldn't be shifting, and that does cause real problems. And you want to make sure you get the diagnosis correctly on that one, and you want to make sure the treatment plan follows that's correct with that. And I think a lot of times, if you just really trace it back to like, what should I do? I got hurt. What should I do? Well, let's do things that make sense, like modify your activity. Take out the things that are making it worse. Like, don't keep, if it hurts when you squat and you feel yourself twisting in the hole, don't keep squatting. Don't keep twisting in the hole. Like, change your routine. The goal, what is the ultimate goal here, right? So you talk about like what the ultimate goal is. If your ultimate goal is regionals in 4 weeks, all right, well, we got to keep squatting. Like, there's no way around that.
Right.
But if your ultimate goal is to be stronger, to have, fill out the shorts, whatever.
Absolutely.
Like, you can do that by other means. And so
Absolutely.
like making those modifications, I think, is really something that I try to hammer home to people that like, look, do you absolutely need to be deadlifting? Your back hurts. Well, technically, no, you don't have a powerlifting meet coming up. What you're trying to do is to be strong and healthy and fit, or maybe you've got a bodybuilding show coming up. Let's make some transitions. Let's modify this. Let's do rack pulls. Do rack pulls hurt? No, they don't. They feel fine. Okay, well, we're going to rack pull then, and we're going to, we'll do some pendulum squats, like we'll modify. And I think that's probably one of the biggest things that people are shocked when I tell them, like, hey, look, I don't want you to quit lifting. I want you to just modify it. And
just do different stuff that doesn't hurt.
Exactly.
Right.
Yeah, I think that's really powerful for people.
So let's talk a little bit about, since we're on the back topic, what are some of the the more common things you see with back injuries from the gym, and what are some of the muscular imbalances that you see as a problem from people that are causing those things?
I can put people into 2 boxes right away. Number one, they came in to see me, they got hurt, and they got hurt doing something that they had a predisposed issue. They had a predisposed factor that doesn't matter what they were doing, it was a ticking time bomb. Eventually it was going to go off. So they'll come in and it turns out they've got severe scoliosis, they've got a spondy, they've got ankylosing spondylitis, they've got a disc herniated, they've got a lumbarization, they've got a sacralization, they've got some mechanical issue that they were going to...
It was a risk.
They were going to find it eventually. Like they had a risk factor and they were going to exploit it. And eventually they lift heavy enough or long enough, they find it, right? So they come in and a lot of times, we can tease that out pretty quickly. And we basically make the diagnosis and say, okay, this is why it happened. This is what you can do to try to avoid this happening again moving forward. So there's a box there of like the mechanical issues. But the other thing that I think I see the most often with is... the most often thing that we see that creates injury is just mechanical back pain, meaning it's a sprain or a strain in the lumbar spine. And most of the time, it actually isn't from incorrect form. Like, I think that I don't want people to run to my house with, to burn my house down for saying that. I agree
it's
that
not from crossfitting.
form is important. Form is absolutely important, and I'm not saying that it isn't. But most of the time, it's an inappropriate utilization of weight. So So either.
So are you telling me that I'm not as strong as I think I am?
No, and that's not it either. It's not that you're lifting too heavy. It's that you didn't ramp up appropriately, or you're at 135 and you're not focused on the weight. You're not thinking about the weight. And so maybe your form is fine, but really what you're doing is you're not bracing like you should, or you're thinking about something else. And so as you're lifting, you're relaxing your spine, and so then something has to give. But with backs, most of the time it's they jumped up in weight too fast or too soon, or they did too many reps and they got fatigued and they tried to lift something that they were prepared to lift, or they were doing something that they weren't used to or didn't understand, so they don't understand the mechanics of it. Those are most often the times that we see back injuries. Like I would say the lion's share, even of like disc herniations, when I see big injuries like disc herniations, it's most of the time it's not rounding of the back in a deadlift or letting the pelvis tilt in a squat. It's not those types of things that the Instagram world and the Facebook world and the internet gurus are going to tell you, like, if you fix this you'll never hurt your back again, like bulletproof your back, let me bulletproof your back. Like I'm the one that sees all the injuries, right? I'm the one that the people come in to see me and I'm like, how did this happen? And it's like, you mean it wasn't so you did all the things that your guru told you to do to bulletproof your back and you still got hurt? Really? Wow. What were you doing? You were warming up. Interesting. Okay.
Yeah.
So I think that a lot of it just kind of comes down to like the mechanical lumbar strains. So lumbar strains and sprains are the most common thing that come out of the gym with injuries, and those are the multifidi, the semispinalis, the iliocostalis, like those small muscle groups that get pinched or torn, and they are created through most of the time I would say through the inappropriate connection between the neuromuscular junction. So. Not ramping up appropriately. And there's a difference between a warm up and a ramp up, and we can talk about that another time. But there's a big difference between warming up and ramping up in your sets and your reps.
And I think the other thing too is people kind of discount they may warm up and they may ramp up, but then they continue to push through other issues that they've had, like you talked about. Maybe they had something else and they have some muscular imbalance, they have some torsion, they have some other length tension issues at certain joints, and they just try and ignore that.
Or like something like a sprained ankle.
Right.
I mean, something as simple as a sprained ankle. I was playing soccer with my kids, or maybe they are the kid playing soccer and they sprain their ankle, and then they go in and then they're playing hurt. Right. So like they're on the platform or they're in the squat rack and they're not right. They're not 100%. And so their mind is focused on that ankle, that neuromuscular connection. They're worried about that ankle, and because of that they twist just a little bit in the hole and then bam. Right. So like that's really common, and that's really what I see all the time. And like when I progress someone back to playing a sport, whether that be lifting weights or whether that be a stick and ball sport or a puck sport, whatever, for those hockey players in the room, or for a glove sport if you're a boxer, MMA, like I let people go back a lot of times a lot earlier than what the textbook says if they're ready. And a lot of that comes down to their psychological analysis that we go through with them as they return back to their sport. They need to be ready to protect themselves. If they can protect themselves and if the tissue has had the appropriate amount of time to heal, then I'll turn them loose.
Right.
I mean, I had a patient, very specific patient that comes to mind right away, that had a torn PCL, which is a ligament in your knee, that requires stabilization following an injury. Like they have to wear a brace, and I'm going to let that person go back to play a lot sooner than what the textbook says, because this person has a higher level of muscle tone, they have the appropriate mental attitude, they have the fortitude, they're ready to go back. They've given it a good 3 months worth of rest for that to scar. The ligament is fine.
That's
now
plenty.
It's time for them to
rock and roll.
To rock and roll, So like, but a lot of times if you look at the literature, it'll say 19 weeks before you're at full return.
Oh,
so,
get out of here!
I mean, like even with some NFL players, like they're holding them back that 6 months. So,
dude,
and that's it's not unreasonable. It's just everybody's a little bit different.
Do you like think as the professionalism or the skill involved in a sport determines the amount of time that you stay out,
like the skill level. So like an NBA player hurt their hand versus a high school player who hurt their hand.
The difference is tissues heal Well, I shouldn't say the same for everybody. If you're 15, you're going to heal a lot faster than if you're 51, right?
Sure.
So a young person's going to heal a lot faster. But if you're, all things considered, same age, like if you take a 22-year-old NBA player and a 22-year-old off the street just playing 3-on-3, tissues are going to heal at the same amount of time. But their return to their activity will be a lot faster for the upper level athlete, and most of the time that's because of their understanding of how it works.
Sure.
Like they're going to go see their trainers, they're going to go see their PTs, they're going to go do their rehab, they're going to do the work.
They have access to that.
They have access to it. Their whole life
choice
rolls around
matters
it.
too.
Sure.
Oh, absolutely. Their nutrition,
Lifestyle choices, nutrition, your ability to train, other muscle
facilities
groups,
that are available to them. Like, absolutely, it's not a level playing field.
No,
but like if you both get cut in the hand, the cut is going to heal at the same, basically the same amount of
That
time.
checks out.
Yeah,
and it's not just once you have the injury, then it's just like, okay, now dial in your nutrition and work. It's what you've been doing leading up.
Oh,
to
correct, absolutely, 100%.
Yeah,
It's
for
not
sure.
like
Just
I got
how
injured, now I'm going to
healthy you
change how
are.
I live.
The protoplasm matters.
Taking
Absolutely.
supplements, I mean, all of it.
All the comorbid conditions. I mean, even if you look at like just the situation that our country and our world is dealing with right now, like if you decide to get healthy today, if listening to us chatter has in some way, shape, or form influenced you to get healthy, do it. Absolutely, 100%. You'd be better off for it. But if you're someone who's been working for the last, decade of your life to try to maximize your health, your outcomes are going to be better.
Oh, for sure.
They just are going to be better.
Yeah, that's just fact. It's
Yeah.
that's the way it is.
Yeah, I mean,
that's kind of the mission around
You are gonna get out of life what you put in.
There we go.
You know what I mean?
Sure.
There's no ifs, ands, or buts about that, right? So I mean, if we're talking about being healthy and getting over injuries here, just from my perspective, like, I mean, one of the things is like, tobacco or nicotine consumption, alcohol consumption, lifestyle choices. Like, let's boil it down to the basics before we even get into the athletic stuff. Like, are you getting enough sleep? That's a huge one. So, I mean, we've talked about sleep on this podcast a ton, but, are you getting enough sleep? Because that's going to be a huge factor in your ability to recover from injuries. Consuming tobacco or nicotine products, that's going to be a big negative when it comes to like wound healing and things like that.
Oh, huge.
Alcohol, I mean,
huge
more
influence.
than people would expect. Because
Oh,
you would
gosh.
think like, oh, that sounds obvious.
Like I'll have conversations with people sometimes in clinic that are very disconcerting to them when I tell them, look, I'm sorry, you've got a torn rotator cuff, you can't have surgery. Like, what do you mean, doc? Like, you're not a candidate for surgery, I'm really sorry. Why? Well, you smoke way too much and we can't fix your shoulder.
Oh, wow.
Like, what? Like, yeah, I'm sorry. If we sew it back together, your tissues aren't going to they're not going to create the vascularization that they need to heal. We'll take a purchase of this tendon and we'll tack it back down and it won't stick. So you've got to stop smoking before we can fix your shoulder. And we have hard conversations with people like that all the time, and they don't recognize the level of change that occurs just at a cellular level with utilizing tobacco products. Like, and it's all tobacco products, and this isn't, no one's paying me to say this, but like
Sure.
It's vaping, it's it's smokeless tobacco, it's smoking tobacco. Like, all those things create vasoconstriction in the small capillaries, and the tendons are not very vascular structures to begin with.
Tendons
and so,
don't heal quickly.
no,
As it is.
and then if you decrease the blood flow to those tendons, it makes it so much worse.
Yep.
So yeah, it's absolutely. And alcohol, people don't recognize how much alcohol changes like your hormones. It changes your it's a downer, right? So it changes your mood. People will tell you that it doesn't affect them in those ways, but if you put your cells in a petri dish and you add that poison, it's gonna change them. Like, there's no way around that. Like, and unfortunately, like, there's a lot of deleterious effects that come from that. It can reduce your testosterone level, and there's a lot of value to having an appropriate testosterone level for healing injuries. So when we're talking about males, obviously there's changes that occur for females as well, but it's definitely, and I think that people probably overlook it when they're doing everything they can in their mind to make sure that they're getting back as fast as they can, but that doesn't come up in their psyche as something that they could change or improve on.
Or exactly. Or their sleep,
Yep.
Like, sleep is such a huge one. I always, nerd out with the Apple Watches and the Aura Rings and all that stuff, but I'll tell you what, monitoring my sleep and putting a value to it every night has forced me to change in so many ways, and I can tell you how much better I feel after having a string of nights where I actually get fully recovered. I mean, it seems really stupid and obvious to say, but it's huge. And in terms of like preventing injuries from happening, and think about those days that you get injured, it's typically not a day where you're like, man, I feel well rested.
It's a weird mindset. I feel like in general population, you hear the brag of, I'm performing with so little sleep.
Yeah.
Where it's like eventually that's going to kind of bite you in the butt, but at the same time, it's maybe the rhetoric, how we talk about this is it's more badass to get sleep than not.
I mean, I think Kaleb and even myself can speak more than most about the lack of sleep.
I feel
sometimes life is life, right?
I'm going to buy Kaleb an Oura ring for Christmas.
That would be embarrassing. I'm feeling here, sitting here speaking about this topic in general, feeling very hypocritical and very sheepish because
very personally attacked
very personally attacked. Eric knows my sleep patterns aren't sufficient. I've struggled. That's one thing in my life that I definitely have not done a very good job of. I feel like I'm doing better now than I ever have.
I would agree.
Before I came in, I was chatting with Ryan, and he was laughing. He's like, "How you doing, Doc?" I'm like, "I'm doing great." And one of the things that I said was, I got a solid 5 hours last night. Like that was that was great. Like it was a solid 5, and there are going to be sacrifices in life if you want to achieve great things. And I'm not saying that I've achieved great things in becoming a physician, but in some way, shape, or form, I came from humble origins. I've earned my stripes. And in order for me to do that, I had to make sacrifices in my life for a decade. And in order for me to make the grades, to show up to class on time, to get through the amount of requirements that I needed to do, and to still raise 3 kids and be a somewhat reasonable husband. Right. My poor wife, God bless her. I had to sacrifice things, and that came in the form of sleep. Sure. It's embarrassing to say. And then during residency and training, depending on how lengthy your residency is, like you're going to be on call. And when you say on call as a physician, you're not at home. You're working. Right. So your shift is 24 hours, and what that means is when you say on call is you're working, and the ER calls you and says you need to admit a patient. So you go down and pick that patient and bring him into the ICU, and then you continue working. No, like you're pounding it. And so those shifts last. They're supposed to be 26 or 28 hours is like the limit, but you do that. In my case, in our residency, we did that every 5th day. So I would then work the next day. So I'd work a 24-hour shift. I'd get off. I'd go home and I would moonlight, and I would work another 8 hours. And because I didn't want to sleep during the day and then not sleep the next night, it's a whole thing. So I would stay awake for 32 hours straight. And then I would sleep for 6 hours, jump back up the next day and go to clinic. And I did that every 5 days for 3 years. And, I began to function and operate at a certain level that was definitely, like, it's not optimal. And I recognize that if I could have slept more, I would have done so much better and had such a better life. And it will catch up to me eventually. And I'm working on trying to prioritize sleep in my life, but and I don't glorify the absence of the sleep, but I think at this point I've lived without it for so long that I find less importance
become accustomed to it.
Well, right. And is there validity to the conversation of you are, in a sense, forced for where you want to go in life to not sleep as much, but to be able to focus on the quality of your sleep?
And like for me, like my quality was always terrible because I was always
well, you're always thinking, your mind's going a million miles an hour.
I was waking up
sleep, forget about it.
Nightmares and anxiety and all the things that this isn't about me, but those things occurred big time. So my quality of sleep was terrible, and even now it's still. I wake up sweating like, oh my gosh, like, did I make the right choice yesterday? Like the choices. If I was flipping burgers and I screw something up, like, did I put cheese on that guy's burger? I don't remember if I put cheese on that guy's burger.
I wake up for 2 seconds.
But here I'm like, was that an infection or was that gout? Like, gosh, I sure hope it wasn't an infection, right? So there's those things that
levels to that.
There's higher stakes at times, but it's we all got things to work on. Nobody's perfect.
and my problems aren't any more everybody's problems are the same, right? Like, it doesn't matter what level your problems are. Anyone who's listening, it doesn't matter if you're flipping burgers or if you're a neurosurgeon. Everybody has problems.
Yep.
And if we all threw our problems in that hat right now and all looked at everybody else's problems, I guarantee you, you'd be grabbing your own problems and ripping them out of that and getting them back. Like, you'd want them and you'd want to go. So, and I'm not saying that I'm special, and not in any way, shape, or form. And what I'm saying is I have a need to improve. Everybody does. And in my life, my need to improve comes in the form of needing to sleep better, more, and to sleep better. But I do think that a lot of times when people are injured, just as you'd mentioned, they're fatigued, right? So their mind is tired and they're not locked in and they're not focused, or they're thinking about something else, and then they're asking their body to do something that's, in and of itself inherently dangerous. So it's like driving a car. Like, you shouldn't drive if you're fatigued. You could crash and die. You shouldn't be maxing on on your bench if you're not really tired, if you're not locked in.
Yeah, and I think people learning to listen to that in their bodies, it comes with experience and time. And the joke is about the young guns, just going balls to the wall and kind of throwing caution by the wayside. But it's and we always joke about how we're old guys, which none of us in this room are old guys really, but we always joke about I ain't as good as I once was, but I'm as good once as I ever was. You know what I mean? But in reference to when you're tossing weight around, I haven't done that as often as I used to. Well, it's because you get smarter.
Right.
It's not that you can't, it's because you get smarter.
I like that.
I could definitely outlift me as a 19 or 20 year old. We're, gosh, how old am I? We're 12 years or so beyond that at this point, 12, 13 years beyond
Recently
that.
Celebrated a birthday.
Right. But old man. But the thing is, and what people, lifters and people listening should understand is that even some days when you do have planned to lift heavy, it's okay to not.
It's okay to deviate. 100%.
It's okay to deviate.
To modify.
Exactly.
Yeah.
You don't you are not a sissy if you don't go in and push squats to the limit that day. If you're not feeling right, or if things are feeling off, there's certain, most of the time the people that won't deviate are the ones that we're talking to. They're the ones that you're not the type of person that's just going to go skip squats. You know what I mean?
Yeah, there's a comfort. I talk to my medical students about this all the time. Two points just came to mind as you were talking about that. First of all, being able to deviate and being able to modify and still achieve your goal. Yeah. There's a certain level of expertise that comes from being at the Mecca and with the trainers that, Dr. Redden told me that he doesn't want me to do X, Y, and Z, and he told me he was going to talk to Eric, who's my trainer, and he's going to help me modify these things, or Ryan, or Marlon, or whoever. And you guys have enough expertise to say, oh yeah, all right, so you've had an injury and you're not feeling your best, and maybe today's not the best day for us to do squats. What we're going to do instead is blank, 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 blank. There are other weapons in the arsenal, right? So that's one thing, is being able to have enough understanding and knowledge of the fundamentals to then expound that knowledge to include some of those upper level movements and do them appropriately so that you can achieve your goal still, which whether it be getting stronger, being fit, being healthy, whatever the goal may be. The other thought that I had about deviating from the plan is that oftentimes that really is so critical. And I think that a lot of times people ask me, what do you what's your training regimen? And a lot of times it's opportunistic. It really comes down to me listening to my body when I step into the gym. And you're right, we're not old guys by any means. We're not in our 80s, but I've been lifting weights now for 27 years.
Seriously,
I was thinking about that the other day too, because I'm God, somebody asked me how long you been lifting, and I was legitimately, I have been lifting hard since I was 12.
Yeah, sure.
Yeah, I've put a lot of time in it, and in doing so, there's days where I will literally go in and be like, today's going to be a chest day for me, and I start warming up, and I start ramping up, and I'm like, nope, today's not a chest day. Today's a delt day or shoulder day, or today's a CrossFit day. I'm gonna go do I'm not gonna choose one body part. I'm gonna do HIIT. I'm gonna do cross training, right? So there's definitely a need to be opportunistic at times. There's also a need to be flexible enough to deviate. But then also, and this is what I was going to say, like, along with that, you need to be accountable enough with yourself to know that you are not just sitting in your comfort zone. Like, you need, there are two zones, and I talk about students all the time when I have medical students and residents and fellows rotate with me. There is a comfort zone and there is a danger zone. You better stay the hell out of both.
Yeah.
You need to be somewhere in the middle all the time. If you're too comfortable, you're not pushing, you're not doing well. So like if you're in the gym and you're like, man, I really don't want to squat again, like I just want to do this, you know. But it's not, because like if you let that become a habit and it becomes comfortable, that's not where you want to be. And that's not the mantra, and that's not what we're telling people to do. But then also, if you recognize, if you can smell the gasoline, maybe you shouldn't light the match, right? Because it might just put the dumpster fire into overdrive. So understanding where those two lines are, and that comes with time. You're not going to walk into the gym day one and know where your comfort zone and danger zone is. That comes with experience, that comes with time, that comes with reps, that comes with hours, and spending those hours in training and having good mentors and having good trainers and having good, you know, gym buddies and partners and family and all those things. Those influences will help you to understand where you're at on that continuum. But I think that it's really imperative for people to stay out of the danger zone, stay out of the comfort zone, and understand that it's okay, and be accountable to yourself, and also don't worry about, and I hate to even use the term because my wife would, don't have an ego. I feel like I can hear her voice right now. Check your ego at the door. Like, if you want to grow, check your ego at the door.
There's no ego. It's just confidence. That's all.
Maybe. That's what I keep telling her, but she ain't buying it.
It's confidence.
She ain't buying
You know, it's funny that you say that, you know, between the comfort zone and the danger zone, because there's a couple of different metrics that really come to mind that I've used as examples in the past. And one of those is, you know, powerlifting terminology, that if you get 3 whites, it was too good. You know what I mean?
Yeah, it's too easy.
You got to be trying a little bit harder than, you know, you got to have at least one judge think you messed something up, right? Or one referee, right? And the other one is, you know, if I'm not aching in one, maybe 2 areas, I'm probably not trying hard enough.
Yeah, and that's a good point too. Like, I wrote an article one time. I wrote an article and submitted it, and it actually got published. That, you know, what are the signs and symptoms of real injury versus just the aches and pains and nags of, like, because people are going to be sitting here listening to this, and they're going to be like, well, doc, every time I go in the gym, like, something hurts. Like, every time I go, there's never a day that something doesn't hurt, right? So, like, you have to understand what the signs and symptoms are of real injury as well. So, like,
so let's talk about
if it lasts longer than a couple of days, if it's lingering for days to weeks, if it's waking you up from sleep, if it's changing your activities of daily living, meaning if it's not just changing the way you work out, but like if you
can't tie your shoes,
if you can't get the laundry out of the dryer because it hurts to bend over, and it actually hurts, and so you're changing the way you're getting the clothes out of the dryer, or if you have any neurologic symptoms, meaning you have numbness, tingling, or paresthesias, like those are things that are not normal aches and pains. If it's changing, the big one is sleep. If it wakes you from sleep, that's a big one. If you start to notice atrophy or deformity, like that can occur with neurologic problems or compromise. Like, people will have you know, like, your body will adapt, and your body, you know, the term homeostasis comes to mind, but if you have an injury, your body will use other muscle groups to allow you to continue to do the movement that you're trying to do, but you'll do it in an abnormal pattern, in an abnormal way. Your kinetics will be completely off. You'll still be able to move it.
And please don't do that.
But don't do that. But you'll be able to move it, but it'll be inappropriately done so, and in so doing, you're basically pounding in new neural pathways of movement patterns. And so you have to recognize that and be conscious about it, and know that, like, outside of the gym, this is affecting me. Like, when I'm driving, it really hurts to have my arm up here like this. So I've been driving with my right arm now, right? If it's unilateral, meaning like if it's one leg versus both legs, you know, if you squatted really hard on Thursday, you should probably still hurt pretty bad Sunday morning, right? Like, if you lifted legs, like, my go-to, my DOMS is 48 hours. Like, I trained legs with the Gym Reapers crew on Tuesday, and like today's Thursday, and there's no way I'm deadlifting or squatting today. I'm not ready yet. Like, my legs would not, but tomorrow I'll be fine. I'll be able to do it. But right now my legs are hurting.
You know,
now I'm not injured, but
I really like to say, oh man, this soreness really sucks. I need to hit that muscle group
Yeah,
again
and
just to loosen things up.
That's reasonable, and you
Sure.
can do that for sure. But I know right now, if I went out and tried to really squat, I wouldn't be able to do it because it just hurts too bad. Yeah.
This is something I think is very important for young people to understand as quickly as possible. Because like you've all coached younger people. You work high school games all the time. It's like I've heard the term good pain and bad pain, but I don't know if that's necessarily what it is. But anyway, that the idea of like you could push yourself and feel discomfort, you're gonna be fine, and that's actually growing.
Yeah. No, you're right, Hunter, and that's a very insightful point to make. That like we tell people all the time, like you need to go to that pain cave, right? Like we want you to hurt, but there's a difference between hurting and getting hurt,
Right.
Yes.
right? So and that is really difficult for people to understand, and we don't want you to. We don't want you to push through some of this pain. Some of this pain is actually really injury, and you shouldn't push through this, which is how we started this whole conversation. So that a lot of times comes down to knowing your body, common sense, and then having an outside influence that you trust. And I think potentially I'm a little bit biased, but I think that comes in the form of an educated specialist.
Right.
For sure.
I think the just very, very superficially, I'll touch on that topic between like say good pain and bad pain. Although I think all pain could be, causing some good mental scars.
There you go.
Mental scar tissue built up, making you tougher. But in terms of, the actual pain on, joints and muscle groups, I don't think joint pain is necessarily ever good.
You're right. It's not.
Like if you're feeling a pain in your knee, probably not good. If you're feeling a pain in your spine, if it's localized to a joint, probably. Correct me if I'm wrong.
No, I'd agree.
Not good pain.
Not good pain.
Good pain, would be things like a burn or a fatigue feeling. Like good pain is that you just can't do it anymore. You're not necessarily feeling like joint pain, but the muscle hurts, the muscle is exhausted, and it's not sharp, and it should not come on quickly.
Yeah, that's the other thing is like understanding the those definitions. Like if your wrist hurts, right? Like there's probably something damaged. Like your wrist there should never be good wrist pain.
There's
no
not good wrist
There's no
pain.
good knee pain, right? You're right. Like, but you can definitely have leg pain in your entire leg, quad, hamstring, glute, gemelli, piriformis.
Oh, yeah.
You name them. They can all be real sore, real hurting, and bilateral. And knowing that, I wrecked them, and that's okay.
Yep. Yeah, and I think that like if it's isolated to a muscle, assuming that you've been intentionally working that muscle, it's probably good. Now, if you're just feeling a lower back pump while you're deadlifting, well, I mean, it's okay to feel a little bit.
Point tenderness over your spine is no good.
Yeah.
Or
exactly.
radiating pain. The other thing is if there's radiating pain, that's no good. Like radiating pain, like it's shooting down my leg, it's shooting from my neck down my arm. Like those are things where you need to pump the brakes.
Muscular tightness and stuff.
And like he's saying, radiating pain's bad, like point tenderness pain's bad, but deadlifting, well, because deadlifting gets a very bad reputation from a lot of people. Like, oh, you shouldn't deadlift, it's bad for him. Like, well, try living your life without deadlifting. Do you ever pick things up off the floor? You need to be able to deadlift. Maybe not 1,000,000 pounds, but even somebody with a bad back, even more important for them to know how and be capable of. Does it mean they need to deadlift all the time? No. But they need to be capable.
And I'm
the mechanics.
I'm a prized example of that, and this isn't about me, and I'm not here
we're
to
all
brag,
about
but
you.
It's all about you.
I've had 2 back surgeries.
Two.
And and those back surgeries are from real injuries, and I've yet I think I hit my max last year in December at 610.
There you go.
So when I got hurt, the first time I got hurt, I was 22 and my max was like 405. So having 2 surgeries since then, and these surgeries came from big injuries, and yet I've still been able to make adjustments and modifications and progress, and I haven't just and my surgeon told me like you'll never, and he listed a bunch of things, right?
Sure.
Yeah.
You'll never blank. Wakeboarding was on there. It's like you'll never wakeboard again because of this injury. And I'm like, well, maybe I will. What'll happen if I do? He's like, if you do, this will happen. And truthfully, he was right. Those things did happen, but I'm good with it. I'm going to live with those consequences. You have freedom of choice. You don't always have freedom of consequence. So the truth is, if you want to continue, you can. You may have to then live with the consequences, which I'm good with. Yeah. And I tell that to patients too. Like, if you're going to continue to do this activity, this may occur. And if that does occur, you need to be okay with those consequences. Like, am I going to tell you to stop? No. That'll be you telling you to stop, not me. I never tell people, unless we're talking about doing meth or drugs, I'll tell them to stop. Yeah, I feel like there's never a good time to do meth. Like, there's never a good time for meth.
Probably not.
We can go ahead and say X-nay on the meth. But for the majority of time, I would tell you, like, that in my clinic, I'm not going to tell people to stop doing things. But if I'm going to give them education to understand, like, what's going to occur if you continue to do these things.
Right. And especially when we're talking about physical activity, you know. And that kind of brings me to, you know, where we were going on the deadlift conversation with, you know, say you are experiencing, you know, a certain pump and muscle burn in your lower back, from deadlifting, right? Common, you know, might be because you're not lifting correctly, right? You're using too much of your extensor muscles at your spine.
Exhibit A on that one.
Yeah, I mean, I think a lot of people have been there before, and it's, you know, but that stuff typically, you know, you're not injured. You don't need to stop deadlifting. That's a time where you need to learn proper mechanics.
Yeah,
right?
Then you lower the weight, restart, and then figure out where, when you creep back up in weight, when does that start happening? Because a lot of times people will move the weight really well up into a certain point,
and then their form
their form breaks down. So there's all kinds of tricks that we go through to help people to learn how to overcome those barriers and those points. But
exactly. Nice. So let's talk a little bit about like some self-care and treatments that people can undergo. Say they do get hurt in the gym. You know, let's bring in myofascial component to that. Let's bring in NSAIDs. Let's bring in ice. Ice is a good one to talk about. That's a good controversial topic.
Sure
ice baths, heat, sauna, hot tub. You know, let's kind of run the gambit with the home therapies.
Yeah, and you know, the list goes on and on and on. Like, we could sit and talk about like the number of things.
You know what I mean.
Theraguns, like the things that people have available to them today are, you know, they really are very vast and wide-reaching.
Yeah.
But I really think that in general, my consensus is, as a physician, again, I would tell people, anybody who's listening, that like, ice is not always the right thing. No. NSAIDs don't work for everybody. And sometimes they're contraindicated. You shouldn't take NSAIDs if you have kidney damage, or if you've had a bleeding ulcer in your stomach, or, you know, if you're on a
muscle
blood
tear.
Right? So like, there are contraindications for certain things. So I would say that a lot of times, again, and I've said this too many times in this podcast, but making sure you have the right diagnosis first, so that you don't create more injury with your treatment. The cure is worse than the ailment.
Let's clarify, people. If you get hurt, you need to talk to somebody to clarify what the actual injury is before you treat it.
Yeah,
so let's make that very clear.
I think that people get in trouble with that, I think, a little too much. Like, I've seen fractures that have been manipulated with myofascial release. I've seen massage.
That felt good.
Right? Like, someone had a sacral fracture and they were getting massage and they were getting chiropractic manipulations, and they're like, you know, I'm really not getting better. And right? I've seen people who have taken ibuprofen and Aleve and Celebrex, not understanding or not knowing that those three all work in a similar fashion, and tank
they
their
were
kidneys.
taking all of those at the same time.
Because you know, like, I mean, I had a funny story one night of a guy who had a heart attack, and he took some aspirin, and he's like, well, the heart attack wasn't getting better, so I took more aspirin. And he just kept taking aspirin. He ended up coming in with a GI bleed, and so we had to send him surgery, sewed up his stomach. It turns out he didn't actually have a heart attack. He had reflux, but it seemed like heart attack, and then he created an ulcer, right? So like that's the self-diagnosis, self-treatment. That's the risk that people get into.
Yeah.
But in general, I think a very safe, to answer that question, a very safe consensus would be if it doesn't hurt, if it doesn't make it worse, and if it seems reasonably safe, then it's probably okay. Like if someone comes in and tells me, well, I've been using Deep Blue, I'm like, well, does it help? Well, I think so. Does it hurt you? No. I'm like, okay, fine. All right, it's okay. It's cool. You're like, I like using Tylenol because I think it helps. All right, fine. I'm good with that. Like, you don't have any liver damage. You're good, right?
Yeah.
Like, I really appreciate myofascial release because I feel like I can move better afterwards, and it's actually helping me. I'm good with that. Like, I'm good with that. Like, a lot of times people will come in and they'll tell me what they've been doing, and I'm like, well, is it working? And the answer is generally no, because they're there and they've tried all these things and they're with me. And I'm like, well, here's the reason why it's not helping, but here's what we can try that might help. But I think that a lot of times people will just, if you try some of those home remedies, heat and ice are both, you know, there's equivocal data in either direction, and I can cite sources to show you that it doesn't change healing time with injuries, both heat or ice, because people will ask me, like, well, what do I do, heat or ice? I'm like, well, what feels better? Like, honestly, whatever feels better to you,
10 out of
use
10
that.
Heat every time.
Oh, gosh, depending. Because, like, some people will say, anyway, so I can show you evidence that's equivocal either direction on heat and ice, but the truth is, like, neither one of those are going to hurt you unless you get frostbite from leaving it on for too long, or you burn yourself because it's too hot, right? So if you stay in those reasonable, commonsensical, you know, keep it between the white lines, then I'm going to be okay with it most of the time.
Yeah, and that's what you're saying, like, with the home stuff. Like, does it help? Well, okay. Cool.
Keep it up.
It's not making it worse, you know?
Yeah, I may be able, like, some people tell me, like, well, this stuff works for me. And I'm like, well, there's absolutely zero data to support that. But if it works, placebo works, then I'm good with it. You keep using it because it's not causing any hurt.
Is real, bro.
Placebo is real.
And there's nothing wrong with that. Like, we've even seen, like, chondroitin and glucosamine. Like, there are actually studies that have shown, I don't recommend that stuff anymore because I've seen studies now, enough studies that have shown that chondroitin and glucosamine are worse than placebo for some certain situations. And so in that case, I would say it's not a good idea, right? And those are over-the-counter. Like, the over-the-counter stuff does have side effects, right? Like, anything over-the-counter can still hurt you.
Oh, yeah.
Top 50 reasons for people to go into the ER, vitamin C is in the top 50.
Is it really?
Yeah, overdose on vitamin C.
Oh, well, and I think part of the problem with that, not to toot our own horn, but is the products out there that have, you know, improper dosages or just are mislabeled, period. You know what I mean?
Yeah.
They did a study on vitamin D supplements that I was reading not too long ago. I'll have to dig this up, but it ranged, oh my God, the range. And it was like, you know, the pill was supposed to be 2,000 IU, and it was like 30,000 IU.
Oh my gosh.
Oh yeah. And pill was supposed to be 500 IU, and it was, you know, hardly any, right? So it's like the regulation of the supplement industry. So that's why, you know, that's what prompted me to start our own brand so that we could have, you know, good products that we trusted, and then brands like Caged Muscle that do excellent third-party testing. And there are others out there, like, you know, just because, you know, I have a supplement brand now doesn't mean that I don't take other stuff. I take it all, you know, and more supplements than most people. But, you know, that being said, everything that I take or that I would recommend be taken is, you know, got third-party testing, you know, the highest quality ingredients. You know, we don't want to put a bunch of unregulated, you know, crap in our body. You know, we're not just,
that's good advice.
We're not just buying stuff from Walmart. But to that point, yeah, I mean, you got to watch your dosages of those things that you are taking, and especially, like, you know, even though you know, Tylenol and ibuprofen and Aleve and, you know, all of those, even though those are over the counter, that doesn't mean that they can't hurt you.
Yeah, no, that's absolutely true. And I did a lecture one time for the athletic trainers at Boise State about the locker room, athletic training room treatments, and those are things that people have access to that, you know, they don't recognize some of the side effects that can occur, and they are real, but they also can be very helpful. So, I mean, a lot of times, like, you know, a couple of aspirin, a couple of Tylenol, a couple of Excedrin, a couple of, you know, whatever your flavor is, and some rest and some ice or some heat, some myofascial, a lot of times, some rest, some modified activity. Those are great places to start. And then, as we've talked about a lot of those other parameters, if you start checking boxes of, like, it's starting to hurt outside of the gym, it's starting to hurt doing normal activities of life. It's waking me up from sleep, then then it's time
I
to
think
get
I think that's a great piece of advice. If something's waking you up from sleep, that needs some
Get to the clinic.
Yeah, that needs some extra attention, right?
Yeah.
So let's talk a little bit about shoulders, because obviously has some of the most range of motion of a joint in the body, right? Get a huge range of motion with the shoulder. So naturally it's going to be one of the least stable joints in the body, and therefore very susceptible to injury. And people like to do things that are hard on the shoulders. Flying off a mountain bike, hard on the shoulders. Skiing, snowboarding, hard on the shoulders. Fun things are hard on the shoulders. So I just wanted to bring up that specific joint and talk about maybe some of the things that can go wrong and how to prevent and or treat shoulder stuff, because I'm sure you see a ton of it. I see you doing Instagram live videos.
Shoulders,
about
man.
I see you
shoulders.
do. Let's revisit this.
Yeah.
Shoulders are interesting. How much time do we have?
Right. Let's hit a few hot big points here.
So the shoulder is a unique and marvelous joint and structure. The mechanics of the shoulder, the biomechanics are phenomenal, and the unfortunate truth that arises is that due to the increased mobility, you have decreased stability.
Right.
And the shoulder joint, out of all the joints that we have, has by far and away the most mobility and has the most unique functional movements. The knee does flexion extension. That's it.
Yep.
Pretty stable joint, right? But the shoulder, flexion, extension, abduction, adduction, internal rotation, hyperextension, circumduction, elevation, depression, retraction, protraction. Like, it can move in so many different ways.
It's got a good list.
It's got a whole list.
Has, horizontal abduction.
Yeah, you can do it in different planes, sagittal, coronal, axial planes. Like, it's phenomenal.
It's nuts.
It really does amaze me. And I've studied the shoulder at length, and I've been in shoulder surgery multiple times with my, I'm not a surgeon, I'm a non-operative physician, but I've been in multiple surgeries for years through training and understand the anatomy even so much better now that I've had the look inside. But and I would defer my level of expertise to some of my partners who are orthopedic surgeons who have been doing shoulder surgery now for 25 years. Like, the level of understanding that they have of that simple joint, it's unfathomable to me. But the truth is, like, in the weight room, shoulders are probably the number one injury that we see are related to shoulders in the weight room. And that goes across the board: powerlifting, bodybuilding, CrossFit, fitness, cross training for athletes. It's shoulder, and then it's back. And most of the time, and those are athletes, those are the younger generation. So I would say the people who are in high school, college, or shortly after. And then in the older, sort of more adult, mature, more grown-up-ish population, it still holds true. The shoulder is so unique, and we see the most common thing that if I x-rayed every single weightlifter that comes into my clinic, I would say the lion's share of them have AC joint arthropathy, because the mechanics of the AC joint require you to put extra stress and strain on that joint, and everything that we do out there. In fact, I've actually wrote a dissertation recently about how to modify activity for AC joints specifically in the weight room. I've found no literature yet on that, and so I'm writing a paper on it. But
someone's got to do it.
Somebody's got to do it for all these meatheads
with all your extra time.
Yeah,
Right.
But the modifications that occur, people don't recognize. Like, squatting can really mess up your AC joint.
Yes,
or,
it can.
Of course, military press, but lat pull down and incline bench press, and there's so many things that people don't recognize that create havoc in that AC joint.
There's so many muscles that cross that joint, because there has to be, because of the extensive mobility that it has. So what people don't realize is you have your two bicep or two of the muscles your bicep. Well, I guess one of them's not really a bicep. Your corticobrachialis, and then the long head of your bicep both cross, right? Then you have pec minor that all cross. You have all your both
back
teres,
muscles,
your
delts,
lats,
cuff,
like your
all
delts.
of it, yeah.
Then you go deeper into your all the muscles of your rotator cuff, and it's just like it is like it's coming onto the humerus from somewhere.
Yeah.
In your trunk, from everywhere.
There's a lot of biomechanical disadvantage that occurs from moving weight, heavy weights in those planes where there's just less stability. So, which is why people can deadlift and squat, 2-3 times their body weight, but they're not doing a military press with 2 or 3 times their body weight.
Right. So let's talk about, speaking of, we've heard the military press thrown out a couple of times. Should... in your most professional of opinions, should people be overhead pressing? Should they be military pressing? What tends to put less stress on, that glenohumeral joint?
Man, I'd have to
dumbbells.
If I say this, I'm gonna have some of these powerlifters and strongman coming to find me. The truth is, I don't think there's a good reason why anyone should do a military press.
You heard it here.
You heard it
here. He might get,
I think that of a lot of that,
a witch hunt.
I'm probably going to be burned at the stake for that one. But there's no reason that people should be hoisting things up over their head, that are 1, 2, 3 times their capacity. Because the truth is, it's just it creates such a mechanical disadvantage in the shoulder. It results in subluxations, dislocations, rotator cuff tears, AC joint arthropathy. If you're gonna do it, go for it. Come see me in the clinic. Here's my card. But military press and log press and overhead press are motions that are just in life. How often do you put something really heavy up over your head? It's not something that you in real life. If we're talking caveman, what you would do is you would stack a bunch of rocks up and then pick it up and push it so that you can push it where you need to do it instead of putting it over your head so that you don't drop it on your head and kill yourself. That's right. Like if you think about all the things we do in the gym, before we lifted weights for fun, the movement of the human body, why we have the muscles to do the things that we do. There are very few times that you need to do something over your head that weighs more than your body. Right. We don't do that in life. So if you equate that then to this parallel of functional movements in the gym, military press is in countless number of bodybuilding, powerlifting, strongman, fitness, CrossFit,
you name it,
athletic training. It's in everybody's programs, and because it's a movement that's easy to learn and do, right? And it seems like it should be natural. You just push something over your head, and it can be quite natural. But if someone's going to do it, my recommendation is, generally speaking, that they see the back of their hands when they do it. If you can see the back of your hands in your peripheral vision, then in general you will be in a safer plane than if you can't see your hands. So when people do behind the head military press,
behind the neck press makes me cringe.
Yeah, I think that I'm not someone that's going to stop a person on the gym floor and tell them, hey, that's not a good idea. That's just not my nature. But I usually turn and look the other way, or I go get them a card.
Yeah,
I think that's a good idea.
Yeah, that ain't a good idea. I think behind the neck, anything. Probably not a good idea.
Lat pull down, same thing.
Yeah, if I ever see anybody doing behind the neck lat pull down, I'm like, dude, you gotta find a better way.
That's not how the lats are intended to operate anyway. With a static closed chain exercise behind the neck, it's not how the lats. Your goal of making your lats bigger or stronger won't be achieved by doing it behind.
No, I mean you're better off doing a high row, rather than, because really, what are you doing? You're just trying to, adduct the shoulder with the lat movement, right? And you don't have to have your shoulder blades protracted, you don't have to have your shoulder blades retracted in order to do that, which is what you're doing with the behind the neck lat pull down. You're retracting your shoulder blades, and pulling that arm down. It doesn't make a whole lot of sense to me why people would go to that movement. And I think it's just kind of one of those things that's kind of just malingering around from.
Yeah, and that's
the
okay. Like
years
we do a lot of things in the gym that are it's okay. Like, people do snatch. I mean, it's an Olympic lift. Like people do it at the Olympics. There's not like in my mind, there's not a good reason to snatch weight up over your head like that and push press weight up over your head like that, other than just to say you do it. Like, there's no good reason to run a marathon other than to say that you did it. Like, there's no if I gotta drive over 20 miles or if I gotta go 20 miles, I'm gonna drive, right? Like, there's no good reason for me to run 20 miles. Right. But the truth is, like, we do it, and that's okay. So I'm not telling people you should. I definitely you don't hear this wrong. I'm not telling people to stop doing military press, but I also don't think that there's ever a really good reason for you to do military press unless it's part of like what you do for life, right? Like, you're gonna do a strongman competition and log presses in there,
right? I mean, I think definitely leads to good shoulder activation for sure in the deltoids in certain cases.
Sure, yeah. But it can be, you can do that with so many other ways that are less dangerous for the shoulder.
Yeah, no, and I definitely do agree with that. I think that as I've gone through time, I've started overhead pressing much lighter.
Mm-hmm. And I guess that's the other thing is I should say, like, you shouldn't, if you're going to do it, you should have your hands in the position where you can see them peripherally, and you should use weight that's reasonable. It's not going to create problems. But the shoulder, the shoulder can be affected with any body part, right? So, like, you'd mentioned it. There's so many muscles that cross it. Back day, chest day, arm day, leg day. Like, the shoulder can be affected. And I think that's probably why, when you look at the number of injuries that we see in the shoulder, it's probably why it's the highest, because it can be affected in so many other different days.
But excellent. Yeah. Well, what other advice would you have for our listeners out there that are curious about all of this, sports medicine, injury prevention, and all that jazz?
I think that good advice would be careful where, and this is a prime example. The irony here is abounding, but be careful where you get your information. And here we are at a podcast talking about it, but be careful where you get your information, because there's so much misinformation that's available to people at their fingertips that, like, you use common sense. If it sounds too good to be true, it probably is. Look at the credentials of the person who's explaining it to you. Understand their background. Understand you may be different, right? So, like, anytime you get generic information, you're going to get generic results. So if you go in and you get specific information for you and your body, you're going to get specific results for you and your body. So I think that it's always important to remember to look at the full equation. Understand where that information is coming from. Be okay. Allow yourself to make modifications. Allow yourself to be accountable. But then again, allow yourself to some grace if you're injured. To allow yourself to rest. Allow yourself to heal. I probably need to hear this as much as anybody else, but allow yourself to rest. Allow yourself to heal. Make sure that you get the appropriate diagnosis for the pain that you're experiencing, so that you can then have a treatment plan that follows, incorporating a multidisciplinary team. And utilizing the expertise that are available to you, I think, is really important. So
flood this guy's DMs. Flood this guy's DMs.
Don't do that.
Don't do that.
Yes.
Don't do that.
Flood the DMs.
I don't have time to check them.
Right? No,
so
I think
do it, but you might not get an answer.
Yeah, I think that's great advice. And like you mentioned, the diagnosis is absolutely key. If it's really bugging you that bad, like, you gotta figure it out. You know what I mean? And don't wait too. That's the thing. Like, if you're having a little thing that's kind of bugging you, and you're like,
don't let it turn into something huge, because that can happen, right?
And
like,
it gets worse. That's the worst thing in the world.
Sometimes if you can get it figured out early, you can get it shut down and fixed. Like, sometimes, dude, I can tell you, the stories go on and on and on and on. Sure. Like, have this person come in, we would have had them better by now. Or this person came in, and now they're going to be better in time for XYZ. Right. So and medicine is not magic, and I wouldn't profess that it would be, but a lot of times we can really deter the course of duration of symptoms significantly by the appropriate treatment.
Oh, for sure. Yeah, I would agree with that. I think that if I've learned one thing over the years, it is to not drag my feet on taking care of an issue. I mean,
that's good advice.
I'm talking to this guy all the time about all the stupid stuff that I do.
We have great conversations, and it's good. And the truth is like, it's such a great relationship, because with the physician's office, and then if I have someone who has a real injury that requires, physical therapy, then there's a bridging program between physical therapy and back to normal life where they've done my treatments, they've done the physical therapist treatments, and then we're working with the personal trainers here at the Mecca to then progress those people back to at least where they were, if not better. The goal is always better, and I think that it has become such a valued relationship that we have, and the trainers can send people in and say, hey, this person has this issue, we figure out what the problem is, and then they can I can provide enough guidance. Yeah, I definitely don't tell them how to do their jobs, but I say, hey, look, these are some things you could incorporate and change and try to help this person still achieve their goal. And just as Huntress had mentioned, I think at the beginning, like, people are really finding a lot of value in that. So I think that that's something that we're grateful for and that we want to continue to do. And if you're listening to this podcast, like, obviously this is going out to a lot of people that aren't here in town, that don't listen or that don't come to our gym and don't have access to my clinic. Like, that's okay. You can look on the AMSSM website and find a sports medicine doctor. Yep. And then you can find doctors, their profiles that explain, who lifts weights and who doesn't. Like, there aren't a lot of doctors who – there are a lot of doctors who lift weights. There are a lot of doctors who exercise. There are a lot of doctors who are physically fit and active and who do what I do. Like, absolutely 100%, no doubt about it. But there are fewer doctors who clang and bang, and I think that put a bandana on and go out there and get
That's
stupid,
just
with the rest of them.
Episode 3.
Yeah.
Check
so what you need to do is, if you're out of town, find that doctor, through the aforementioned channels, and then stalk their Instagram.
Yeah.
If they're not jacked and tan,
that dog ain't gonna hunt.
That dog ain't gonna hunt.
Yeah. Well, thanks again, guys, for having me. This has been a real pleasure, and I'm grateful that there's so much great information. You guys have had some wonderful guests and continue to do so, and hopefully this podcast really does a lot to improve people's lives. I think it really will. So thanks again for having me.
I think you're a big part in helping us do that. I hope the wonderful people of the Power of Lifting podcast, our listeners, got a lot out of it. I know that I definitely enjoyed our conversation and learned a thing or two.
I wrote quite a bit down,
as always, from the muscle doc himself. So yeah, always a pleasure. We're gonna have to do this again. Third time's the charm.
There you go.
But I love having you on. I love the conversation. I appreciate you, and you're a good man. So thank you very much.
You are as well. Appreciate it, guys.
All right. Well, friends, that's a wrap. We'll catch you guys next week.
Thank you for joining us on the Power of Lifting podcast. Be sure to like, comment, subscribe, and share. For more content like this, follow EricCafferty and the Mecca Gym on all social media platforms.